Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Streptolysin O. Streptolysin O is a toxin which is seen on streptococci, especially on group A, group C and group G streptococci. This streptolysin O is an oxygen labile and it is serum stable. This streptolysin O is mainly active in the reduced state and it is inactive in oxidized state. It is similar to nemolysin, titanolysin and perfringolysin. One important thing about streptolysin O is it is strongly antigenic, and this streptolysin O is raised, that is anti-streptolysin O. If it is more than 200 units, then it indicates that there is a recent streptococcal infection. But one important thing is, where do you use this anti-streptolysin O? Anti-streptolysin O is actually a criteria of Jones criteria which is seen in rheumatic heart disease or in rheumatic fever. Actually, it's not rheumatic, yeah, it is in rheumatic heart disease. Now thus in rheumatic heart disease you will see presence of raised ASO titer is seen, but in pyoderma and glomerulonephritis it is not important, but it is important to indicate that there is a recent streptococcal infection, that is streptolysin O. Then we also have streptolysin S. Streptolysin S. S stands for oxygen stable and serum soluble. In streptolysin S, S stands for oxygen stable and serum soluble. In streptolysin S, there is hemolysis is seen on the surface of anaerobic blood culture plate. So if you do a blood culture and in the blood culture plate aerobic blood culture plate, and if you put a streptococcal uh, species over there, inoculation in the blood culture plate, then you will see that there is hemolysis is seen. This streptolysin S is not antigenic.
thank you and thank you for watching.